The opioid epidemic continues to ravage our state from the rural, the suburbs, right into the city. It is why today the Baltimore Police Department, along with several other agencies, announced a new way to tackle it. ABC 2 News' Brian Kubler joins us now with more. Brian?
Kelly, the popular line of the day was treatment instead of handcuffs. A new program adopted from Seattle is now coming online here in Baltimore. It's a shift away from policing addiction and toward treating it. A fair amount of the city's power brokers gathered in the small Baltimore Police press room to announce a collaboration on a program they hope flips the script on addiction. Simply put, the Law Enforcement Assisted Diversion program, or LEAD, offers a treatment center over a jail bed.
Rather than responding with handcuffs and jail time, police officers will be working with skilled clinicians to engage with people who have substance abuse problems and get them connected to treatment and support services that they desperately need.
It's with the help of Behavioral Health System Baltimore and other nonprofits, private and some public money, that LEAD is possible. People who could be charged with a low-level drug possession will now have a choice: accept help or possibly get locked up. Currently, LEAD is only a pilot program on the west side of downtown. Police will focus on the area around Lexington Market. More than 120 officers in the Central District have already been trained. Of those is Lieutenant Steve Olson, who lost his own brother to addiction.
The officers that I've been surrounded with to work in this program care as much as I do. And if I couldn't save my own brother, I'd like to save yours. I'd like to save your mother and your father, your brother and your sister. So the passion on my end is matched by the officers that I work with, and we can't wait to start working.
The program started today, and the city thinks it will be helping 60 people at any one time. LEAD was born in Seattle, and City Councilman Bill Henry heard about it right after the riots of 2015. He and so many others, from the police commissioner to the state's attorney, worked in concert to bring this program to Baltimore this year.
I'm often hesitant about this because I like to say we can't police our way out of a lot of the problems that we're in. But this is one case where the police can be positively helping to eliminate the root cause of crime. And that's not often that we get that opportunity.
The opportunity to intervene instead of incarcerate. LEAD defines addiction as an illness, not a crime. A different approach, the police commissioner says, can make a difference here in Baltimore.
They're suffering from substance abuse, and incarceration does little, if anything, to cure them of that addiction. So there has to be a different way to approach folks who are suffering from drug addictions.
This program has been in place in Seattle for a few years now, and Councilman Henry says that city has seen a decline in its recidivism rate. Davis says if his officers see less and less of the people they routinely arrest for low-level drug charges, then he'll know it's working right here in Baltimore. This pilot is scheduled to go 3 years, with an eye on eventually expanding it citywide if it is successful.